All right, so we are still hearing from you about vaccine hesitancy. One of those lays out concerns about how immigration status could really impact getting an appointment. Dozens of groups are calling on Governor Kemp for help, asking some after some have claimed that they were actually turned away. Here is 11 Alive's Paula Suro with their story.
Eso es discriminación.
That's discrimination in my eyes.
Consuelo says she was turned away from getting her shot not once, but twice. First, she was at a Kroger in Gainesville, then at the Gwinnett Place Mall. Both times she says she was asked for proof of residency or citizenship, and after showing her Spanish passport, she was turned away.
I had this dream of getting the shot and came back without it.
She's one of dozens who have called the Latino Community Fund with this concern. LCF's executive director, Gigi Pedraza, says people, especially some living in counties like Gwinnett, DeKalb, Clark, and Habersham, have been denied the vaccine from both state-run and private providers.
We know that several of our community members that are leading organizations have been asked to provide insurance and Social Security. So this is something that is happening.
That's why her organization, along with more than 55 other groups and state representatives, signed a letter and hand-delivered it to Governor Brian Kemp last week. Among many recommendations, it asks that providers put up posters making it clear that nobody can be denied for not having insurance or ID, and that anyone, regardless of immigration status, can get the shot.
We have a number of hardworking Georgians that are working to regularize their situation, and they have been afraid that the vaccine will be considered public charge.
While Pedraza has not heard from Governor Kemp, she says she's been able to talk about this to Health Commissioner Dr. Kathleen Toomey. Kroger provided us this statement and said to call their pharmacy team if something like this comes up. Pedraza believes the big problem is that those administering vaccines need to be trained better and know the statewide rules.